Hello, welcome to Advanced Health Assessment Didactic, and today we are going to perform a uh, provider's head-to-toe assessment on an adult male. First, we're going to gather our supplies, and we're going to gather our supplies, and we are going to um, introduce ourselves and provide privacy. I'm going to wash my hands and don gloves, and we're going to measure our patient for vital signs. There's going to be our blood pressure, heart rate, respirations, pulse oximetry, and for time purposes, we will not manually take the blood pressure. We have our materials here for blood pressure, pulse ox, temperature, and respirations will be counted over 60 seconds. From the measurement of the vital signs, we're going to have the patient stand up, and we're going to take his height and weight. You can stand right here, and we have him at 200 pounds, and we're going to measure him at 6'3". And as he's standing here, I'm going to note his general appearance. He's hygienic. His age is his color is appropriate for his age, and he is well groomed. While he's standing, we're going to take a look at his posture, his mobility, and his his stature was all intact. You can take a seat now. Now from the door, I want to ask you, how do you feel today?
Feel okay.
Great. His mood and his affect is appropriate, and moving forward, I'm going to assess his nutritional status. How's your appetite been?
It's been well.
Great to hear. Now, assess the ability to speak and assess the ability to hear, which is both intact. Now, we're going to move lastly, we're going to assess the patient's orientation. So I'm going to ask you, can you state your full name, where you are, your date of birth, and the year?
My name is Shavarius Hepburn. I am in San Francisco. Date of birth is 12/6/92, and the year is 2025.
Great. The patient is alert and oriented ×4. Now we're going to move to the head and face assessment. With the head and face assessment, we're going to start off with the skin, and with the skin, we're going to be noting for discoloration, distribution of facial hair, and lesions. From the skin, we're going to move on to the hair. And when we're assessing for the hair, we are assessing for quality, we are assessing for texture, we are assessing for distribution and hair loss. No hair loss noted. Distribution is appropriate. Now, after inspecting the hair, we're going to inspect the scalp. When we're inspecting the scalp, we are inspecting for scaliness, lesions. We are inspecting for possible insects, and we will assess thoroughly by moving the hair parts in several different ways. Now, we're going to move from the scalp to the skull. So when we assess the skull, we are looking for size, contour, and symmetry, and no abnormalities noted. Now we're going to palpate the skull. When we palpate the skull, we're going to be palpating and assessing for deformities, depressions, lumps or tenderness. No lumps, no tenderness, no depressions, and no deformities are noted. Now I'm going to assess the temporal arteries here for amplitude, and they are a +2 and appropriate. Now I'm going to assess the maxillary and frontal sinus. I'm going to put pressure here, no tenderness noted. And now at this time, we're going to move to the sensation of the face. Can you close your eyes and tell me when you feel something?
Feel something.
Great.
Now.
Great.
Now.
Great. Our sensation on our face is intact. Now we're going to move forward and assess for our cranial nerve 5 and 12. Can you wrinkle your forehead for me? Great. Can you wrinkle your eyes? Great. Can you smile? Great. Can you lick your tongue out and move it from side to side? Great, thank you. Can you clench your teeth? Great. Can you blow a bubble with your cheeks? Great. And now I'm going to inspect the face for contour, symmetry, and involuntary movement, and that concludes the head and face assessment. Now we're going to move on to our eye assessment. With our eye assessment, we are going to first test our visual fields. I'm just going to look at 6 minutes. We're going to test our visual fields. I'm going to have you look at me on my nose. I want you to cover one of your eyes, and I'm going to cover one of my eyes, and I want you to tell me how many fingers I have up.
2
and
2
and
1
and
1
great. And now other eye, great. And
2
all right,
2
okay,
1
1
1.
okay, great. Our visual fields are intact. Now moving from our visual fields, we are going to assess for corneal reflex. I have my pen light here. If you would mind, shall be staring at the back of the wall here, and I'm going to take this pen light and I'm going to shine it in the middle of in between his eyes, and I'm checking for any abnormal deviations or gaze. Great. No abnormalities noted. Now we're going to assess for cranial nerve 3, 4, and 5, which is our six positional gazes. If you look at me, straighten out my nose, and keep your head straight and follow the pen, please. Great job. All right, now we're going to assess for pupils if they're equal, round, and reactive to light, and we are going to assess for accommodation. Just look straight at me, and here comes the light. Great.
Yes.
Great. And then please keep your eye on the pen. Great. Pupils did constrict, and our pupils are equal, round, and reactive to light at a 2. At this time, I am going to wash my hands. I'm going to don gloves, and I'm going to assess the conjunctiva. I'm going to assess the sclera, conjunctiva, corneals, and iris. All right. Look up for me. Sclera is clear and white, and conjunctiva is pink, moist, and intact. And corneals and iris is no misshapes noted. Now with the eye exam, I am going we are going to use our ophthalmoscope to assess for the retina, the optic disc, and the ovea and macular. Alright, good read. Great. Great. No abnormalities noted. And now, finally, we're going to use our Snellen's eye exam. I'm going to put this 20 feet away, and then I'm going to ask the patient to read, cover one eye and read the lowest line that you can see.
EFTZD.
Great, and then the other eye?
GLEF.
Okay, great. I'm going to document my findings. Patient is his vision is 20/20, and that concludes our eye exam. Now we're going to move to our ears. So when we're assessing for our ears, we're going to assess for the external. We're going to inspect the external ear for intactness, symmetry, alignment, intactness, symmetry, alignment, and tenderness. From there, we're going to assess the canal of the ear in inspecting for lesions or discharge. No lesions or discharge, or no lesions or discharge are noted. Now I'm going to palpate the head for the lymph nodes of the face. And per the rubric, we do not have to describe the locations of the head, the lymph nodes of the head. Now we're going to palpate the external ear and the mastoid for size, symmetry, and size and tenderness. And no tenderness noted. Now we're going to take our otoscope. We're going to pull considering he is an adult male, we're going to pull the pinna back and look inside the ear for the tympanic membrane. The tympanic membrane is pearl and clean and intact. No redness noted. And I'm going to pull the pinna back and great job. Okay, now no abnormalities noted. Now I am going to perform our whisper test. Can you repeat after me? Today is a good day.
Today is a good day.
Great job. All right. Now I want you to put your hand up or tell me when you hear. And when you start to hear, and then when you stop to hear the sound.
Now. It stopped.
Great.
Now.
Great.
It stopped.
Great. And then tell me what side you hear this on.
On the left side,
On the left side
in the center.
and the center.
Yes.
Great. Okay. And that concludes our eye exam. I mean, our ear exam. Now we're going to move on to our nose. So when we're looking at the nose, we are looking for symmetry or lesions. And then we're going to test for patency. Keep your mouth closed and take a deep breath. Great. Nostrils are patent. Can you smell this?
Mm-hmm.
What does that smell like?
Like a piney woody smell.
Great. And then lastly, I'm going to use my pen light and I'm going to inspect the nostrils. Clean, dry, and intact, and moist. And that concludes our nose assessment. Now we're going to move forward to our mouth assessment. Okay, so when we're assessing the mouth, we're going to put this one. When we're assessing the mouth, I want you to open wide for me. I'm checking teeth. I'm checking the teeth. I'm checking tongue. I'm checking open wide. I'm checking the buccal mucosa. I'm checking the soft palate, the hard palate, the floor of the mouth, and the lips. I see open wide for me, and I don't see no tonsils are noted. And then I'm going to use tongue depressor, say ah, and I'm looking for mobility of the uvula, and that is present. And that concludes our mouth assessment. Now we're going to move on to the neck. When we're assessing the neck for symmetry, pulsation, and lumps. Then I'm going to inspect the thyroid gland. I want you to look straight at me, take a swallow. It's symmetric. Please look up for me, right at the ceiling, and then swallow again. Great, and thyroid gland is still symmetric. Now I'm going to assess for jugular vein distension. No jugular vein distension. No jugular vein distension noted. And I'm going to auscultate for cardiac group. And I'll palpate also. Great. Now, with the neck, I'm going to assess. I want to come around. I'm behind the patient now, and I'm going to palpate the thyroid gland, noting for size, symmetry, consistency, and tenderness. And none noted. No abnormalities noted. Now I'm going to move to the cervical. I'm going to palpate the cervical lymph nodes for size, shape, consistency, tenderness, edema, and nodules. None noted. And for a carotid pulse, which I feel is about a +2. Okay. And then I'm going to, for the neck, I'm going to check for any tracheal deviation. And then no deviation noted. I'm going to ask you to perform range of motion. I want you to look up, down, left, right, side to side, and then all around. Great, thank you. And that concludes our neck assessment. Now we're moving on to our chest assessment. So for our chest assessment, we're going to inspect the configuration of the thoracic cage, which is equal. And now we're going to assess the skin of this gas, which is we're looking for texture, lesions, and color, which are all appropriate. And now we're gonna assess for symmetry of the shoulder muscles, the shoulder and the shoulder muscles, and then we are going to assess symmetry for chest expansion. Deep breath for me. Great, thank you. And then lastly, I'm going to compare the posterior and lateral diameter. And now with the chest, I am going to palpate for tactile firmitus. Okay, and then I'm going to palpate for tactile firmitus, and I would like you to count to 10, and I'm going to be palpating for vibrations throughout.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Great. No consolidation is noted. I'm going to palpate for any lumps or tenderness. Okay, and I'm going to palpate for alignment of the vertebrae, and that is intact. And now I'm going to percuss all the lung fields. All tympanic and sound. Percussion sounds tympanic, no dullness noted. Now I'm going to auscultate all of our lung sounds. Great job. Now I'm going to come posterior. Great job. Lung sounds are clear, diminishing the bases. Now I am going to test for egophony. Please say E.
E. E. E.
Good job. No consolidation noted. And that concludes our chest assessment. Now we're going to move to our cardiac assessment. So we're going to first assess for JVP, and then look right for me. Great job. And I'm going to look on both sides for JVP. No JVP noted. I'm going to palpate for the pericardium. Okay. And after palpation of the pericardium, I'm going to listen to all five valves of the heart and note rate, rhythm, and call out any irregularities as in reference to splitting of S1, S2, noting S1, S1, S2, S3, S4, or noting any murmurs. So I'm going to I'm going to start with our aortic, pulmonic, fluent, tricuspid, mitral. And then with the bell of the stethoscope, I'm going to listen to the apex of the heart. Appropriate. Now I'm going to percuss I'm going to percuss the border of the heart. I'm going to point out maximum of the PMI. And we have our PMI right here. And that concludes our cardiac assessment. Now we're going to move on to our upper extremities. For our upper extremities, we're going to start off looking for our skin. Our skin is, we're looking for TLC, which is texture, color, and lesions. And I'm going to look at the hands, on both hands, and turn over, and I'm looking for a capillary refill. I'm looking for any clubbing. I'm testing the skin temperature and skin turgor, and they were for appropriate. And I'm going to palpate for the radial and brachial pulses. That is good. Now I'm going to assess for motion of the shoulders. So can you move your shoulders like this for me? Great job. I want you to I want to inspect the motion of the elbow. Okay, and up this way. Great job. And then I want to assess for motion of the hands and wrists. Great. Okay, and now we transition from motion to strength. All right, so I'm going to shrug your shoulders for me. Great job. And then now I'm going to assess for the strength of the arms. Thank you. So far, and then strength of the hands and the wrists and hands. Bring force down for me. Great job. And that concludes. No, and I'm going to. Does you feeling numbness or tingling?
No.
Any numbness or tingling?
No.
Great. That is our Tenille sign, and then we're going to do our Fallon sign. Can you bring your arms like this for me and apply pressure, and then we'll hold that for 60 seconds. And test is appropriate. And that concludes our upper extremities. Now we're going to do our lower extremities. So we're looking at our lower extremities. We're looking at skin for distribution. We're looking for skin discoloration, distribution, and varicose veins. Along with that skin, we're looking for TLC, texture, color, and lesions. We're also assessing. We're also assessing for our lower extremities. We are assessing for edema. We're assessing for temperature of the skin and skin turgor, and we're assessing for arterial insufficiency. And then we are going to palpate the femoral artery. We're going to palpate our popliteal, and then we're going to palpate our dorsalis pedis. And that concludes our lower extremity. Now we are going to move to our abdominal assessment. So with our abdominal assessment, we're going to inspect the abdominal area for contour, inspect the umbilicus. We're going to inspect the can you expose your abdomen for me? We're going to look for contour. We're going to look for the umbilicus. We're going to look for pulsations, and we're going to look for symmetry, all intact. And then we're going to look at the skin for TLC, texture, color, and lesions. Then we're going to auscultate for the aortic, renal, iliac, and femoral arteries with the bell of the stethoscope. Renal, iliac, and femoral. And also, we're going to listen to, without the bell of the stethoscope, we're going to listen to the 4 quadrants of the abdomen for bowel sounds. Bowel sounds are present and active. Now I'm going to listen to the hum over the liver and the spleen. Okay, that concludes our auscultation assessment of the abdomen. Now we're going to transition to percussion. Okay. All right. So with percussion, we're going to with percussion, we're going to measure our liver. And I want to do that I want to start with at the mid-clavicular line and go to the 5th intercostal space. And then I'm going to percuss, and then we're going to note the most dullness aspect. And then we're going to go to our iliac crest, and I'm going to percuss upward to our most dull area, and then mark that. And our liver size is going to be the difference between the two, which is approximately 7 centimeters. Now I'm going to percuss to assess for splenomegaly. I'm gonna pulse across the chest. Across the abdomen, and no any tenderness. Okay. Now we are going to listen. I'm going to percuss over all 9 quadrants of the abdomen to note for any tympany or dullness. Now the percussion is complete, and the abdomen is tympanic. Now we're moving from percussion to palpation. I'm going to lightly palpate assessing for superior or deep masses, noting any guarding, noting any tenderness. Okay. Not any pain?
No.
Great job. Now I'm going to palpate for any rebound tenderness. And then I'm going to palpate the liver's edge. And then I'm going to palpate the spleen and the kidney for any tenderness or enlargement. No enlargement noted, or no tenderness or enlargement noted. Now we are going to assess our special test. We're going to assess for the gastrovertebral, you can say that for me, gastrovertebral test, and we're assessing our kidneys for any tenderness or any pain. I'm gonna locate our number 12 rib cage, and then I'm gonna mark all right, I'm gonna mark there, put my fist on, and any tenderness?
No.
Okay, great job. Now I'm going to assess for the ascites. So I'm gonna have the patient lay back. I'm going to percuss for tympany or any dullness. And I'm going to note this area, and then I'm going to turn the patient towards me. Great job. And I keep my hand there, and then I'm going to percuss. And if there was a shift from tympany to dullness, I will note the fluid shift. Thank you. Now I am going to assess for appendicitis. If you will lay down for me, I'm going to perform our Rosalind sign. I'm going to lift your leg up. I'm going to support it. Okay, and then I'm going to apply pressure to the thigh and tell me if you feel any pain. Any pain? No? Great. Now I'm going to keep your leg up. I'm going to ask you if you have, I'm going to perform the psoas test. And I'm going to lift your leg up, and I'm going to note for any pain in the quadrants. Any pain?
No.
No? Great. And then lastly, I am going to do the obturator test where I'm going to hold the leg and flex the leg, and then I'm going to move the leg inward and assess for any pain. Any pain?
No.
Great. All right. The ascites, appendicitis, and then now cholecystitis. I'm going to assess for McMurray's point, and that's going to be in the right upper quadrant. And right upper quadrant. McMurray's sign is going to be 1/3 from the umbilicus and the iliac crest. And do you feel any pain?
No.
Great. Moving forward, and that concludes our abdominal assessment. Now we're going to do our neural assessment. You can look up here, okay? And then I want you to put your arms out, touch your nose with your right hand and then left hand. Great. And then if you do it rapidly, great. Well, faster. Yep. Great. Now I would like you to take your heel and rub it against your shin. Down. Yes. And then switch for me. Great. Now close your eyes. I'm going to check for sensation. Tell me when you feel something.
Yeah. Now.
Great.
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 Now.
Great. For the sensation, we test for the upper and lower extremities in the hands and in the feet. Now I'm going to test our reflexes. I'm going to test for your brachial Alright, now I'm going to test for your brachial radialis, and I'm going to do 5 centimeters above the wrist, and we are reflex is positive. Now we're going to do our bicep. Do a flex for me, right there, great, and then relax, and then great. Reflex is positive. Now we're going to I'm going to do our tricep. Okay. All right, that's positive. And now we're going to do our patella. Just lean forward and relax. Yep. Yep. Mm-hmm. Like dangle. Yep. Mm-hmm. Yep. Relax. There we go. And now our last is going to be our Achilles reflex right here. Great. And that concludes our neural assessment. And now we're going to move on to our musculoskeletal. Can you stand up for me and walk across the room? Great. And come back. Can you walk on your tippy toes? Great job. Can you walk on your heels now? Great job. And then stand still for me and close your eyes. This is the Romberg's test. Okay, no swaying. Pass. Now I'm going to ask you to bend your knees halfway for me. Great job. I want you to bend over and touch your toes. Great. And now I want you to perform a range of motion with your spine. I want you to flex your spine. I want you to extend your spine. I want you to rotate your spine, and I want you to laterally move your spine, please. Okay. And let's see. And that. Oh, and then I'm going to palpate the cervical, thoracic. I'm going to palpate the cervical, thoracic, and lumbar aspect of the spine. And that concludes our muscular assessment. Thanks for your time.